Hello everyone, welcome back to Nimsite and welcome to the Australia series as well. In this series, I talk about various things related to Australia, my PR journey, international student information, your visa options, etc. You can check out those videos if you're interested to migrate to Australia or to visit Australia as well. So today, as part of the Australia series, I'm going to talk about a very interesting topic, Australian healthcare system. So let's move to that part. Australian healthcare system. When we talk about the Australian healthcare system, we have to talk about Medicare. What is Medicare? Medicare is a universal health insurance scheme in Australia. Now, using Medicare, you get access to a lot of health services at low cost or absolutely no cost in some cases. Now, Medicare gives, why is it universal? Because everyone has the same amount of access to the health services irrespective of their income, age, etc. That's why Australian healthcare system is called a universal healthcare system and is considered good. Now, how Medicare works is usually everyone needs to pay from their taxes. So based on these taxes and the government funds, that is how you get access to healthcare at low cost or subsidized prices. Now, who has access to Medicare? Medicare is normally given to citizens, permanent residents, and in some cases some kind of visas like humanitarian visas or some other visas also have access to Medicare. But for other temporary residents or for students, they generally don't have access to Medicare. That is why they are advised to take a different form of private health insurance. What is covered in Medicare? Now, it actually differs and it may vary from one hospital or from one medical center to the other medical center. There is something called bulk billed. If your medical center is bulk billed, that means all of the costs will be associated with Medicare and you don't have to pay anything out of pocket. So out of pocket cost is the cost that you will pay after the Medicare rebate is cut. That is the cost that you have to pay. So if it's a bulk billed hospital, you may not have to pay anything. For example, if you go for some scans related to your pregnancy or you had to conduct some tests, and if that particular clinic or that particular pathology lab or anything for that matter, if it is written that it's bulk billed and if they say that all these services would be covered, you don't have to pay anything out of pocket. But in some cases you may have to pay something but at a subsidized price. For example, the total cost for a consultation could be $80 and you get a Medicare rebate of around $40, so your out of pocket cost can be $40 as well. So most of the centers, they do this as well. You get some rebate, like a 40% rebate based on your Medicare, and the rest of the fees is taken by those private clinics. So that is how it works. And in public hospitals in general, for your major surgeries and for your emergency things, all of that is covered under Medicare. That is, you don't have to pay anything out of pocket. That is what happens in the big public hospitals. So these are some of the services, and before you go or before you consult like any health center, it is good to check like what all costs are covered under Medicare and what would be your out-of-pocket costs. That is the tip. So how does it work, or what to do if you're feeling unwell? Now, usually the first step is going to a general practitioner. Now, a general practitioner is someone who has specialized in general medicine and family medicine. So they will check you and they will prescribe some medicines. They will look at your symptoms, and if it is something that is within their care, they would give you the necessary treatment or necessary medicines that would be required. But if it is something serious and needs specific attention, they will then refer you to specialists. So if it's related to your ear, eye, or for example anything else that seems to be severe, they would then give you a referral document and you would then take that document to that particular specialist. And once you take that document to that particular specialist, you are then offered care. Now, the fees or the cost associated with all these consultations and care will depend. If you have a Medicare and if it's like a public hospital and if they say those costs are covered, like I mentioned before, if it's like bulk billed, it could be your out-of-pocket cost could be zero for the consultation as well. But or if as part of the Medicare, you could be offered some kind of rebate. In other cases, for example, for international students, they generally don't have Medicare, so they would have taken a private healthcare insurance based on some healthcare providers that are registered or that are considered eligible by Australia, and based on that, they would have to give whatever out-of-pocket cost that particular GP wants based on the private healthcare insurance. So that is how the whole system in general works. What is the difference between public and private hospitals in Australia? Now, public hospitals in Australia are generally funded by the government, and usually most of the services are covered by Medicare. Like, having said that, I would say emergencies and general referrals or major surgeries would be covered by Medicare, so your out-of-pocket cost would literally be zero in those cases. But in other cases, you may have to pay something depending on the service and depending on how much bulk billed or what is the cost that they take. So that is how it usually works. For example, if you have like a major surgery, for example, if someone has a surgery related to pregnancy in a public hospital, their out-of-pocket cost will literally be zero. You don't have to pay anything, and you often get the best care also in severe cases. But having said that, the wait time is extremely long in public hospitals. You may have to wait for quite some time for some services, unless it's like emergency or a life-threatening incident. They would take you in immediately, but in all the other cases, you may have to wait for considerable amount of time, even if you have a Medicare in a public hospital. On the other hand, private hospitals are generally owned by some organizations or some people privately. They are usually not covered under Medicare, and you need to have a private health insurance if you want to have any kind of subsidized cost in these private hospitals. And the advantage in this case is that the wait times could be extremely less as compared to public hospitals. You may get specialized care, you may get specialized treatments and aftercare treatments as well if it's a private hospital. So do you really need a private health insurance? Now, like I said, for international students, of course, it is mandatory to have a private health insurance as part of your visa requirement itself. You need to have private health care insurance that gives you access to basic services like GP consultations or any other basic services. You should have access. And for others, I would say private health insurance is normally taken to supplement or complement the Medicare. For example, dental services and ambulance services also in some states, or some other optical related services, are not covered under Medicare. So people usually take private health insurance or private add-ons for these kind of services, and in this cases they would use their private health insurance, and for all the other cases they would use Medicare to get healthcare at a subsidized cost and get rebates as well. This was a general overview of the Australian healthcare system. If you have any questions, put it down in the comments, or if you want to offer any clarifications of the things that I mentioned, you can put down that in the comments as well. And I'll try to cover more videos about my experience with the Australian public healthcare system. And if you want to know how to enroll for Medicare or something is not clear to you, put it down in the comments as well. So with that, we come to the end of the video. Thank you so much for listening, and I'm glad that some of these videos in this series were helpful to some people. And if you like this particular video as well, make sure to subscribe. Thank you. Content shared in this video is based on personal experience and research. If you enjoyed the video, like, share and subscribe. Keep watching, keep listening and continue learning.